And thank you for continuing to be a little patient with us as we're working through to adjust to this new setup. We really want to be sure we're keeping everybody safe and walking the walk of social distancing. So thank you, and we appreciate your patience. My name is Dr. Betsy Tilson. I serve as a State Health Director and Chief Medical Officer for the Department of Health and Human Services. And with me is Director Mike Sprayberry, Director of Emergency Management for North Carolina. Before we take some questions, I will give a little bit of an update on what people should do if they feel sick, and then Director Sprayberry will discuss supplies. And then we should be able to take questions for about 15 minutes or so. So the CDC is now recommending that people who think that they may have COVID-19 and have mild symptoms should stay home, separate themselves from others, and call their doctor for medical advice. We have a new fact sheet to help North Carolinians know what to do if they are sick. It's on our website, and our communications team can make sure that you get a copy. It helps people understand that when someone with mild illness leaves their home to get tested, they could expose themselves to COVID-19 if they don't already have the infection. And if they do have an infection with COVID-19, they could give it to somebody else, including somebody in their community at high risk for complications, or a healthcare provider who will be needed to care for people with more severe illness. And remember, a test will not change what someone with mild symptoms will do. The vast majority will recover at home. Testing is most important for people who are seriously ill, in the hospital, in a high-risk setting like a long-term care facility or a nursing home, and for healthcare workers and other first responders who are caring for those with more serious infections with COVID-19. This is particularly important as we face a nationwide shortage of personal protective equipment. We need to be mindful so that our healthcare providers have the supplies they need to care for people who need medical attention. Your doctor can help you determine what's the best course of action for you. I've talked to many doctors across the state, and they've been heroic in standing up a variety of ways to increase access to safe care for their patients, including telephone accessibility, video, FaceTiming. And I'm so grateful for our medical providers for being so adaptable and always putting the safety of their patients first. And remember, for most people with COVID-19 infections, it will cause mild illness, and the safest thing for them is to stay at home. However, we do know it can make some people very ill. So while anyone can call their doctors if they're concerned about their symptoms, this is especially important for people at higher risk for more serious illness. According to the CDC, this includes people who are 65 years of age and older, or have a high-risk condition such as a chronic lung disease, asthma, heart disease with complications, compromised immune system, severe obesity, or other especially poorly controlled underlying medical conditions like diabetes or kidney problems. And since we know pregnant women are at higher risk for severe illness from other viruses, they should be vigilant. However, as of the data that we have now specific to COVID-19, we have not seen a specific increased risk for COVID-19 in pregnant women. And while children are generally at lower risk for severe infection, some studies now are coming out that maybe they're higher risk, especially for our infants. Anyone with more serious or worsening symptoms should call their doctor or 911 right away. Those symptoms would include worsening shortness of breath, difficulty breathing, chest pain or pressure, confusion, or blue lips. And again, while most people who have mild illness will recover at home, and then they can go back to their normal activities when they can answer yes to all three of these questions. Has it been 7 days since you first had symptoms? Have you been without fever for 3 days without any medicines for fever? And are your other symptoms improved? Once you can say yes to all that, then you can go back into your life. Thank you, and I'll turn it over now to Director Sprayberry to give us an update on supplies, and then we'll take questions.
Thank you, Dr. Tilson. Again, my name's Mike Sprayberry. I'm the Director for the North Carolina Division of Emergency Management. This is day 15 of our activation at the State Emergency Operations Center for COVID-19. 48 counties also have their county emergency operations centers activated. 94 counties have declared states of emergency. This morning, we received our second allocation of personal protective equipment from the Federal Strategic National Stockpile. The shipment was delivered to our warehouse on 5 trucks and included N95 respirators, surgical masks, face shields, surgical gowns, and gloves. A logistics team from the Air National Guard Airmen unloaded those trucks and supplies and were quickly allocated and sent out to medical facilities across the state that need those items. We received a similar shipment of supplies from the stockpile last week. Those supplies were also quickly sent out to medical providers across the state, and providers are using them up quickly. We look forward to future allocations from the Strategic National Stockpile. Governor Cooper has reiterated our state's need for more federal supplies to the President and Vice President. We also have a logistics team working hard to source as many of these items as we can get on the private market. Obtaining these critical supplies is my top priority. We greatly appreciate the donations of personal protective supplies that are coming in from corporations and individuals. If you have supplies you would like to donate, you can send an email to our Business Emergency Operations Center. That email address is beoc@ncdps.gov. Again, beoc@ncdps.gov. Our priorities for the State Emergency Response Team include sourcing critical supplies, making sure we have the personnel and equipment needed to respond to COVID-19, helping our public health partners and hospitals prepare for large expected numbers of coronavirus patients, and sharing information with our internal and external partners. North Carolina 211 continues to help hundreds of people each day with assistance and information related to the coronavirus. By dialing 211, people can help with needs like food assistance, assistance with paying rent and utilities, support for families, or just basic information. You can also receive information from 211 by text. Just text COVIDNC, again, that's COVIDNC, to 898-211 to get regular information updates via text. Thank you, and I'll turn it back over to Dr. Tilson.
Thank you, Director Sprayberry. We're happy to take questions.